Hello everyone, my name is Sukma Rahayu from Knowledge Hub for Reproductive Health, Faculty of Public Health, Universitas Indonesia, and today we'll be presenting the results of our study entitled Impact of COVID-19 Pandemic on Health Services Utilization in Indonesia. December 2019 was the first time when an outbreak of coronavirus disease caused by SARS-CoV-2 occurred in Wuhan, China. Followed by January 2020, WHO declared the outbreak as a public health emergency of international concern. COVID-19 has spread widely and rapidly, and in Indonesia have reached more than 3 million cases with 2.8% case fatality rate and more than 90,000 deaths. The government of Indonesia has implemented various measures such as large-scale social restrictions or PSBB and public activity restriction enforcement or known as PPKM. The COVID-19 pandemic affects almost all aspects of people's life, not only in by causing certain medical condition, both physically and mentally, but also the impact of the policy response itself to the economic condition, education, and other social activities. Besides the impact on socio-economic, the health system has also been disrupted due to the limited mobilization of health workers and closing of many primary healthcare centers and clinics. The COVID-19 pandemic has caused an abrupt reduction in the use of in-person care. Healthcare visits such as inpatient visits, emergency department visits, and outpatient visits have significantly decreased since the start of the pandemic. Therefore, the study objective is to describe the impact of COVID-19 on health services utilization in Indonesia. The study is cross-sectional study using self-administered online questionnaire, which was distributed through media social, association, and NGOs platform. It was composed of 32 self-item report, consists of socio-demographic, changes in income, expenses during pandemic, knowledge and health practice towards pandemic, and changes in health service utilization information, and was collected from August to October 2020. In total, there were 904 respondents collected by non-probability sampling. The article clearance was brought by Institutional Review Board of Universitas Indonesia, and the data will be analyzed and presented in descriptive statistics using Stata Application version 16. Results and discussion. Table 1 shows socio-demographic background of respondents. A total of 904 respondents have willingly completed the online survey. Of all respondents, 3/4 of them were women, and a large portion live in East Java and West Kalimantan. Respondents' age range between 15 to 70 with mean age of 29.5. Nearly half or 46.2% of the respondents were below the age of 25 years group. Table 2 presents the distributions of respondents' health service utilization. We assess respondents' use of routine health services before and during the pandemic. Overall, there was a decrease in the use of health service during the pandemic by 20.4%. However, most of the participants answered there was no change in routine health service utilization. From income perspective, respondents with low income or below 1.7 million per month had a notable change in health service utilization either in increase or decrease. Economic resources such as income and wealth enable access to material goods and services including utilization of healthcare services. By region, the decline in the use of health services in West Kalimantan was highest on 22.3%, which might be due to limitation of patients received by health facilities, especially at the beginning of the pandemic. Patients may have chosen to delay in-person care during the pandemic even when the policies restrictions were lifted. In addition, the small number of health facilities compared to Java hinders people from seeking service on health facility. The figure presented is the most reported barriers in accessing health services during pandemic. Reduced income became the most mentioned barrier from respondents, followed by a threat of getting infected. This barrier is often associated with food insecurities households because of insufficient financial resources. Changes in healthcare utilization can caused by the lack of knowledge of the virus and fear of contracting the disease, especially in the most affected population groups such as women and girls, older persons, and people with chronic disease. A critical factor in understanding a population's response to a threat is fear or concern, since it is an important predictor of behavioral changes and health securing behavior. Almost all the respondents participated in the survey stating that they are concerned with the situation in Indonesia. Fear and concern are also correlated with public trust on government action in handling the pandemic. The online survey describes the public trust on government in the figure on the right. The results show that trust in the government is lower in DKI Jakarta, where it acts as the epicenter of COVID-19 pandemic in Indonesia. More than one-third respondents answered don't know, which indicates the indecision and skepticism on government action on handling COVID-19. Trust in government leaders is play an important part in managing a threat by affecting public judgment about the risk of COVID-19. Specifically related to the current crisis, other researchers point to the idea that greater trust in government leads to more compliance with health policies. In conclusion, there was a disruption in healthcare utilization during COVID-19 pandemic in Indonesia. This disruption may be associated with several factors, mainly due to reduced income. Government efforts such as policies and programs that focus on monitoring of health protocols and strengthening equitable access may be needed to maintain visits and service quality. The Ministry of Health, in collaboration with other stakeholders, should enhance the utilization of telemedicine and virtual care services, especially on vulnerable population. Telemedicine has helped protect both providers and patients from the risk of exposure to COVID-19. That will be my presentation. Thank you for listening and for your kind attention.